Hello students, I will show today a very common basic surgical instrument in a small procedures or basic procedure it is being used. Just see that instrument and identify small procedure. It's very essential, of course, what that instrument is. See this, see that there is no lock here, no ratchet. That is very important, no ratchet. There are few instruments in surgery, there are no ratchets, which you have to remember. One is D-Jardine cholecystectomy forceps for removal of the CBD stone. Another is the Sinus Forceps. Another is this instrument. So this instrument is Sinus Forceps, Lister Sinus Forceps. No lock, finger bows are there. In the distal blood, there is small serrations here. Tip only there are serrations. There is a sinus, Lister's Sinus Forceps, remember. Lister is the father of the aseptic surgery. So asepsis in surgery he has started actually. So there is no lock, that's point you have to always remember. And what are the features? It has no lock, serrations at the tip only. What are the uses? To drain an abscess, especially pyogenic abscess cavity by Hilton's method of drainage. Hilton's method of drainage principles are always under regional anesthesia or general anesthesia. No local anesthesia which will not act because first is acidic media. Local anesthesia, xylocaine will not act in acidic media, it requires alkali media. Regional finger block, wrist block, shoulder, brachial block can be used, but not local. And clean and drape, aspirate and confirm always it is pus only, especially in the popliteal region, axilla, femoral region, so that should not miss for the aneurysm. Then make a adequate incision, open the skin and open the pyogen, open the skin, expose the abscess, then through a sinus forceps, this sinus forceps without like lock, Lister sinus forceps, break the pyogenic membrane, then collect the pus for culture, break all loculi with the sinus forceps and little finger, then give a good warm normal saline wash, then don't suture the wound, pack the cavity, then put the dressing, allow the wound to heal from the depth. And always start antibiotic before draining an abscess. Under the umbrella of antibiotic, you have to drain the abscess. Then regular dressing will heal properly and completely. Once culture report comes, you can switch over the appropriate antibiotic as such. This is how exactly you drain an abscess. So please go through my clinical methods in surgery current edition with video lectures of how to examine the patient. All examinations detailed given, and my 7th edition or current edition SRB manual of surgery that in detail every topic test with illustrations, photos, top management is discussed very well. Entire thing, facilities covered with the online MCQs, with the case discussion as such. Everything is covered. My operative surgery minor to major procedure, 2-volume atlas and test in detail step by step with illustrations and photos. Please go through that for any procedure, and tissue approximation, small atlas with the method of suturing properly, any suture clearly with the corresponding video lecture, videos, how to do it is also given very nicely. Please go through that. My Digin or lectures, entire surgery is covered, including clinical examination, operative surgery, X-ray, instrument specimens, and also urology, neurosurgery, cardiothoracic, all topics as per CBM syllabus. It is covered in detail. Please subscribe for 1 year for final year PGs and postgraduates. Is very, very useful. Students, I hope you have understood this instrument very well. Thank you very much.